All right, we're going to continue our look at the cardiovascular system by going over blood vessels next. We just finished covering blood, so now we'll look at the tubes that carry blood. Um, your blood vessels are basically termed the vascular system, so it's the vascular part of cardiovascular. Um, your blood is going to circulate within those blood vessels, and that transport system is closed, meaning that your blood stays within those blood vessels. We've got different types of blood vessels. We have arteries. They are going to carry blood away from the heart. So you remember A for away. Arterioles are essentially just smaller arteries. They continue to carry blood away from the heart, but they're going to connect arteries to capillaries. Capillaries and capillary beds are our smallest blood vessels, and they serve to connect arterioles to venules. And those are also going to be where the exchange happens for oxygen and carbon dioxide and nutrients and waste. Venules are going to drain capillary beds, so blood will move from capillaries into your venules. They're essentially just small veins. And then they carry blood into veins, which help to return blood to the heart. If we look at the microscopic anatomy of blood vessels, they've got layers to their walls, and we call those layers tunics. You can see them here in this diagram. They are labeled. I know it's kind of small and hard to see, but we'll talk about each of them. So we have the tunica intima. You can see that up here. That is the inner layer. So they think of like intimate, like close, inner. It lines the lumen of the vessels. The lumen is the opening. So if you think of almost like your blood vessels like a straw, the plastic part of the straw, or if you're being environmentally friendly, the paper part of a paper straw, or if you're using a metal reusable straw, the metal part, like that outer part that makes the tube, that would be the wall of the blood vessel. And then the part that you would drink through is the lumen, and that's the part where the blood would flow through in the blood vessel. There's this slick surface on the inside of the tunica intima, and that helps to reduce friction from blood flowing through them. The middle layer is the tunica media, and that is where the muscle in blood vessels, the walls of blood vessels would be. So think of media, middle, and muscle. Okay. It is smooth muscle there, and that's going to be playing a role in changing the diameter of the blood vessels. So it could increase the diameter or decrease the diameter. And what would happen is it's going to have an impact on your blood pressure. So if your blood vessels constrict, that's going to make there be less space inside of them for blood to flow through. So that actually increases your blood pressure. If your blood vessels dilate, that's going to increase the space that blood has to flow through, so that will decrease the blood pressure. And then tunica externa, think of external. It's the outermost layer, and that's there to help support and protect the blood vessels. So you can see this kind of like light pink part inside here in the artery, and here in the vein, and then here in the capillary. That is the tunica intima. In the artery and the vein, this layer right here below where my cursor is, that's the tunica media. It's right here in the vein. It's thinner in veins than it is in arteries, and we'll talk about why later. And then this outer layer here and here is the tunica externa, or that outer layer. So we'll start with arteries. Their walls are much thicker than the walls of veins, and that is, like I just showed you on that previous slide, because they have a heavier tunica media. They have more smooth muscle in their walls. The reason for that is that they're closer to the pumping action of the heart, so they have to be able to both expand and recoil as blood is forced through them. For veins, they are farther from the heart in the pathway of blood, so the pressure is lower. So the walls can be thinner because they don't need to withstand that high blood pressure. Their lumens, or the opening that is the tube inside of veins, are larger than they are in arteries. Your veins, the larger ones, also have valves to help keep blood returning to the heart. Most blood in veins has to go and be moved against gravity, so the valves will help to do that. Skeletal muscle is also going to help veins get blood back to the heart. So when you are moving let's say your legs, your skeletal muscles in your legs are contracting and relaxing, and that helps to kind of push the blood through them or kind of milk the blood through them back to the heart. The pressure inside the thoracic cavity where your heart is located is going to drop when we inhale. So when you take a breath in, that causes that pressure change in your thoracic cavity it's going to decrease the pressure. And the large veins near the heart, such as your superior and inferior vena cava, they're going to expand and fill with blood to get that blood finally back to the heart. And we call that the respiratory pump. Capillaries are only one cell layer thick, so the only layer they have is the tunica intima. They're going to form kind of interweaving networks that we call capillary beds. So you can see like this whole structure here would be a capillary bed that would go from an arteriole to a venule. And there's two types of capillaries in the majority of capillary beds. We're going to have a vascular shunt, which would run right through the middle here. And then you're going to have true capillaries, which would be off of either side of that vascular shunt. So the vascular shunt is just going to let blood go right from an arteriole to a venule because the blood there has already dropped off its oxygen and nutrients and picked up waste and carbon dioxide. So it's just ready to get back into the venules, to the veins to get back to the heart, so it can be pumped to the lungs to get more oxygen. The true capillaries are what we think of probably when we normally just think of capillaries. That's going to be where the diffusion process happens. So the blood would go into the true capillaries. You're going to have oxygen and nutrients dropped off to cells and waste and carbon dioxide picked up from cells. True capillaries will number between 10 and 100 in a capillary bed, and that's going to depend on the organ or the tissue that those capillaries are serving. True capillaries will branch off from like the proximal end of the vascular shunt and then return at the distal end. So they would branch off here and kind of return over here. There is going to be a sphincter, what's called a precapillary sphincter. It's smooth muscle that surrounds kind of the root of each true capillary and acts like a valve. So if the blood no longer has oxygen and nutrients to be dropped off, those sphincters are going to be closed, and that keeps blood from flowing out into the capillary bed, and it just gets it right into a venule to get returned back to the heart. If there is oxygen and nutrients to be dropped off, then those sphincters would open, and we would see that what's happening in this top part of the diagram actually happen, where the blood goes out into the true capillaries, and that diffusion process would happen between the blood in the capillaries and the surrounding tissue. Some problems that can arise with veins. One of those is varicose veins. So what happens in that condition is that the valves are kind of overworked and they give way, and the veins become twisted and dilated. This is common in people who stand for long periods of time, because if you're just standing still, the blood kind of pools in your legs. You don't have that milking action of your skeletal muscles to help return blood to your heart. So people who, again, are on their feet all day, mainly standing in one spot, usually like a hairdresser, for example, would be more prone to developing varicose veins. Next, we have thrombophlebitis. Okay, if you remember, we talked about a thrombus, clot. So thrombophlebitis is a vein that is inflamed, and that's going to happen when a clot forms in a vessel with poor circulation, and that's actually a complication of varicose veins. So that would be like if that condition worsened, that could develop into thrombophlebitis. And then a pulmonary embolism would be when you would have a thrombus somewhere, a clot somewhere. It detaches and travels to the lungs, and it can block blood flow to the lungs. That is a common consequence of thrombophlebitis. That clot might break off. A pulmonary embolism can be fatal It is possible that it is fatal, although it may not be. We're going to talk about blood pressure in a little bit, but we're going to go through some of the major arteries in the body first. So we're going to start with the aorta. It is the largest artery in our body. It's going to leave the heart from the left ventricle. When it leaves the heart, it's still going to be the aorta, but the name kind of changes depending on where it is in the body. So right here, the heart would be right here. So this would be where the aorta would be leaving the left ventricle. Right here, when it's going upward out of the left ventricle, it's called the ascending aorta. And then up here, it would be called the aortic arch. From there, it's going to curve down behind the heart, and then it's called the thoracic aorta. And then once it passes through the diaphragm, it's going to go into your abdominal cavity, and it's referred to as the abdominal aorta at that point. We've got some branches of the ascending aorta. Again, that would be this part right here of the aorta. So here is your heart. You would have the right and the left coronary arteries that branch off from the base of the aorta. Both of those serve the heart and give blood to the heart. So really the first place that your heart pumps blood to is itself through those coronary arteries. From there, you're going to have some branches of the aortic arch. The first branch that comes off is the brachiocephalic trunk. That's going to split into the right common carotid artery and then the right subclavian artery. The second branch is the left common carotid artery, and that splits into the left internal and then left external carotid arteries. The third branch from the aortic arch is the left subclavian artery, and that branches into your vertebral artery. At the armpit, it becomes the axillary artery, and then in the arm, it becomes the brachial artery. At the elbow, it splits and becomes the radial and ulnar arteries at that point. There are branches of the thoracic aorta, so you have 10 pairs of intercostal arteries that supply the muscles of the thorax, like your chest wall muscles. Bronchial arteries will supply the lungs. Esophageal arteries supply the esophagus, and phrenic arteries supply the diaphragm. So you can see a lot of these, the name of the artery will go with the part that it serves. For the abdominal aorta, again, that is once the aorta passes through the diaphragm. You would have the celiac trunk, that's the first branch, and that is going to split and take blood to the stomach, the spleen, and the liver. Next, we have the superior mesenteric artery that will supply the small intestine, as well as the first half of the large intestine. Next would be, or right here on this diagram, we would have your right and left renal arteries that supply your kidneys with blood. Now, the blood that's going to go through your renal arteries is going to be cleaned as it passes through your kidneys. And then the blood that is in your renal veins, even though we're not talking about veins right now, I'll still mention it. The blood that's going into your renal veins would be filtered and cleaned blood at that point. Next, we have the right and left gonadal arteries that supply the gonads. In females, we would call it the ovarian arteries. In males, we would call them the testicular arteries. Then we have the lumbar arteries that's going to supply the muscles of the abdomen as well as trunk walls. Inferior mesenteric artery is going to supply the second half of the large intestine. Remember, it was the superior mesenteric artery that gave the first part of the large intestine blood. And then we have the right and left common iliac arteries. Those are going to be the final branches of the abdominal aorta. And those vessels will continue to divide, and they'll supply the pelvis and the lower limbs with blood. If we look at major veins near the heart, I mentioned these two earlier, the superior vena cava and inferior vena cava. Those are bringing blood back to the heart from either the upper body or the lower body. So the superior vena cava brings blood from the head and the arms. Inferior vena cava brings blood back from the lower half of the body to the heart. We're going to look at special circulation. One of those would be the arterial blood supply to the brain. The brain, hopefully, obviously, is super important, if not the most important organ in our body, because without that functioning properly, nothing else would work right. So our brain needs kind of a special blood supply to protect it and give multiple routes for blood to get to the brain. So there are both anterior and posterior blood supply of the brain. And there's going to be small branches of arteries that kind of have those two blood supplies connected almost. There's going to be a circle that forms of connecting blood vessels, and we call that the circle of Willis. It surrounds the base of the brain, or it's also called the cerebral-arterial circle. And the way this, or why this is special, is that it helps to protect the brain by giving more than one route for blood to get to different parts of the brain in case there is an impairment in blood flow to the brain, or in case there is a blood clot. It still gives multiple routes for blood to try to reach all areas of our brain. Another case of special circulation would be fetal circulation. The lungs, as well as the digestive system, don't function in a fetus. So both gas exchange and nutrient exchange happens through the umbilical cord, which is connected to the placenta. And then that's connected to the uterine wall. So the mother takes care of those things for the fetus. Nutrients and oxygen move from the mother's blood into the fetal blood. And fetal wastes move from the fetus into the mother in the opposite direction. There's actually 3 blood vessels in the umbilical cord. There's 1 umbilical vein and 2 smaller umbilical arteries. There's also other features present in the fetus that go away either at birth or shortly after birth when the baby breathes on its own. An example for before birth is there's actually a hole in the septum, the wall that separates, in this case, the atria, or the 2 upper chambers of the heart. We call that the foramen ovale. And what that does is normally we have a complete wall in between the right and left side of our heart to keep oxygen poor blood on the right side from mixing with oxygen rich blood on the left side of our heart. But in a fetus, there is a hole there, and that allows blood to go from the right side of the heart to the left side of the heart, bypassing the lungs, because the lungs aren't working in the fetus because it doesn't breathe on its own. So that hole should close at or shortly after birth. There is a slight remnant of it in the heart called the fossa ovalis, and that can be visible in the right atrium. So sometimes it does not close at all, and then in that case, the baby would need surgery to close that heart, the hole in the heart, so it doesn't have that mixing of oxygen-rich and oxygen-poor blood once the baby is breathing on their own. Let's see. Next kind of special circulation is hepatic portal circulation. So this looks at the liver. Okay, so the hepatic portal circulation with the veins of that are the veins that will drain the digestive organs of blood. They'll also drain the spleen and the pancreas of blood. From there, that blood gets taken to the liver from those organs, and they'll get there through what we call the hepatic portal vein. Blood is going to filter through the liver pretty slowly, and some nutrients will be removed to be stored or processed in different ways. The unique thing about this circulation and why it's part of the special circulation that we're talking about is that veins actually bring the blood to the liver to have that blood filtered rather than arteries bringing blood to the liver. Like in the case of your kidneys, your arteries, your renal arteries take blood to your kidneys to be filtered. It's the veins bringing blood to the liver for it to be filtered in that case. For the physiology of circulation, and then we're going to be getting into talking about blood pressure here a little bit. So we can kind of test how efficient our circulatory system or cardiovascular system is by taking pulse measurements and blood pressure measurements. Those two measurements, along with your breathing rate and your body temperature, we call vital signs. For pulse, we'll start there, arterial pulse. So when you are taking your pulse, you are feeling a certain pressure point of an artery where you have an artery that's fairly close to the skin surface. And what you're feeling is like the stretching of that artery wall with each beat of the left ventricle, creating a pressure wave of blood through the entire arterial system. So it is equal to the heart rate. That's how we can tell our heartbeat from our pulse. So you're feeling that pressure wave of blood through. So for example, when you take pulse, you're supposed to use your pointer and middle finger. Take pulse. If you were going to take pulse at your wrist, you go just below the base of your thumb with your pointer and middle finger. And you should be able to feel your pulse right there. The average pulse is between 70 and 76 beats per minute at rest. It can be considerably lower if a person is very athletically fit. Because that means that their heart is pumping more blood with one beat than somebody else who might not be as healthy and their heart doesn't work as well or as efficiently. Your pulse can be influenced by your activity. So for example, if you just got done running 5 miles, your pulse is going to be higher than if you are laying in bed watching Netflix. Postural changes will also influence your pulse. So your pulse is going to be lower if you are laying flat compared to if you are standing up. And that is because if you're standing up, your heart's pumping blood against gravity to circulate all of your blood, where if you're laying down, your blood is all kind of on one level. So your heart doesn't have to pump against gravity that way. Your emotions can also influence your pulse. So if you're angry or stressed, that can cause your pulse to be higher than normal. What we see on this diagram here are pulse points over major arteries. So normally, most common places that people will take pulses are on your radial artery or your common carotid artery in your neck. But you could, for example, if you were in an accident and they're checking for blood flow to your toes because maybe you fractured your leg or something, they would be using your dorsalis pedis artery at the top of your foot. You can take the pulse there. So these are just some common places where we have pulse points because you've got major arteries relatively close to the skin surface that let you feel that pressure wave of blood. For blood pressure, that's basically the force, the pressure that your blood puts on the inner walls of your blood vessels. Your blood pressure is what keeps blood moving continuously, even in between your heartbeats. And normally with blood pressure, they usually take it on your upper arm. You want to take blood pressure closer to the heart because it's more accurate. And you want to use an artery for the fact that that's getting the blood right from your heart into the arteries rather than a vein. If you tried to use that, it's not going to be accurate at all because there's possibly negative pressure or zero pressure in your veins the closer you get back to your heart. So normally they use your brachial artery to take your blood pressure right above your elbow on the pinky side. When you measure blood pressure, you're going to get 2 measurements as part of that reading or part of that vital sign. The first measurement is called the systolic pressure. That is the pressure in the arteries when your ventricles are fully contracted. So the normal range for systolic number is between 110 and 140. The second measurement is called diastolic pressure, and that is the pressure when the ventricles are fully relaxed. The normal range there is usually between 70 and 80. So the way we would record blood pressure is systolic over diastolic or systolic/diastolic, and the units for blood pressure are millimeters of mercury. In the first blood pressure cuffs, I guess we'll say, they're technically called sphygmomanometers. In a blood pressure cuff, they used to use mercury in there, so we just kept those same units, even though if it's still a manual one, usually they have like alcohol in them if there's like a gauge rather than a dial, but we still use those millimeters of mercury. the unit. So an example would be 110 over 70 millimeters of mercury. Again, you also, if the person is in a different position, that can affect, just like for pulse, different body positions can affect your blood pressure as well. Some things that can impact or change your blood pressure. Something would be cardiac output, which is how much blood is pumped out of the left ventricle per minute. If you have a very efficient cardiac output, your heart's not going to have to beat as often and your blood pressure is going to be lower. Something else is peripheral resistance. So that's how much friction your blood's encountering as it flows through the blood vessels. So if you have like plaque buildup in your arteries, that's going to increase your peripheral resistance, which is going to increase your blood pressure. Okay. Anything that increases cardiac output or peripheral resistance will cause a rise in blood pressure pretty immediately. All of these last things listed here can affect your blood pressure. So your age, usually the older we get, the more our blood pressure goes up. Your weight, typically, not always, but typically the more a person weighs, the higher their blood pressure is. Time of day, so usually in the morning, your blood pressure is lower than later in the day. Exercise, so either if a person exercises regularly or in the case that they just finished exercising, that can impact their blood pressure reading. Body position, so if they're laying down, sitting up, standing, even if they're sitting but their legs are crossed, that can impact the blood pressure reading. Your emotional state, and then any drugs the person might be on, and that includes medications, like prescribed medications, that can all alter a person's blood pressure. There are neural factors, so nervous system factors that can influence blood pressure. Our autonomic nervous system causes vasoconstriction, which means that our blood vessels are going to be narrowed, and that's going to increase blood pressure. That occurs when you stand up suddenly after laying down. So let's say you're laying down, you're sleeping, and then your alarm goes off, and it's like the 10th time you've snoozed, and you realize you're super late to get to school or to work or whatever, and you jump up out of bed. Okay. What's going to happen in that case is that gravity is going to cause blood to pool in the vessels in the legs and the feet, and your blood pressure will drop. Okay. You do, in the large arteries of the neck and the chest, you have these receptors called baroreceptors, and they kind of send off warning signals in that case that causes your blood vessels to constrict and get your blood pressure to normal. If that didn't happen, then you would get really lightheaded and dizzy, which sometimes does happen. When your blood volume decreases suddenly, like if you are in an accident and there's somebody hemorrhages, if you lose a large amount of blood, your blood pressure is going to drop, and your heart rate will increase to compensate for that. And then the amount of blood being returned to your heart is reduced because of the fact that you're losing blood. So the heartbeat will be weak, and not very sufficient to actually keep that blood circulating. So in that case, vasoconstriction should occur to hopefully increase blood pressure again. When somebody is exercising vigorously, or if they're really frightened, vasoconstriction can happen, except in our skeletal muscles. The vessels in your skeletal muscles will dilate to increase blood flow to them. That's kind of like a fight or flight response there. However, so your sympathetic nerves will cause vasoconstriction to happen in these instances. However, those vessels to the heart itself or to the brain itself, your sympathetic nerves will never cause those vessels to constrict, because you want adequate blood flow to your heart and to your brain. Renal factors can influence your blood pressure. So your kidneys do play a major role in regulating your blood pressure, and they do that by altering the volume of your blood. So if blood pressure or blood volume is high, then your kidneys are going to allow more water to leave the body in your urine. That in turn is going to decrease your blood volume, and then from there will decrease your blood pressure. When blood pressure or blood volume would be low, the kidneys are going to keep water from leaving in your urine. That's going to increase your blood volume and then also increase your blood pressure. Some kidney cells will actually release an enzyme called renin, and that gets released into the bloodstream, which will cause kind of a cascade reaction of chemical reactions. So what happens is a chemical that will cause vasoconstriction called angiotensin 2. I know it's hard to see here, but that is a Roman numeral 2 right there. So angiotensin 2. That is going to cause sodium to be reabsorbed by the kidneys. Water follows the sodium, so it gets pulled back into the blood and then increases blood volume from there. Temperature can also influence our blood pressure. So cold temperatures have a vasoconstricting effect. That's why if there is swelling, like an injury where there's swelling, you should put a cold compress on it because that helps reduce swelling. Heat does the opposite. It has a vasodilating effect. So if you need to increase circulation to an inflamed area, you would use a warm compress in that case. Chemicals can also influence blood pressure. Epinephrine can increase blood pressure and heart rate. Nicotine will increase blood pressure because it is a vasoconstrictor. And alcohol and histamine will decrease blood pressure because they're going to cause vasodilation. So there are other chemicals as well, but these are kind of some more common ones. Some problems with blood pressure, and if you are unlike me, you can probably stare at this little thing for a while and not feel anything. If I look at it too long, it makes me feel dizzy. But so first we have orthostatic hypotension. That is a temporary low blood pressure as well as dizziness caused by rising suddenly from either a reclining or a sitting position. So again, like laying down and then jumping up. For example, this is common in elderly people. So as people age, this is a common issue that they have. So what they recommend people to do if this happens to them is to kind of change positions more slowly. So let's say that like, you know, I don't even know how old your grandparents are. My grandma was like 92, lived to be 92. So we'll talk about her. So for my grandmother, if she would have had this issue, what they would have told her was when you are ready to get up out of bed, you should sit up and then just sit there for a minute. And then you can turn your legs so they're hanging over the side of the bed and stay there for a minute. And then stand up, wait a minute, and then you can start moving from there rather than just trying to go from laying to standing up right next to the bed all at once. Okay, that just helps to keep your blood pressure from dropping too quickly from that sudden change in position. And then we have hypertension. That is chronic high blood pressure. So we had hypotension up here. That is low blood pressure. Hypo means low. Hyper is high blood pressure, hypertension. So hyper means high. In somebody with hypertension, their heart is pumping harder because there's increased resistance for their blood. That can enlarge the heart muscle, which over time is going to actually weaken it. Your blood vessels can also get small tears in them, which will accelerate what we call atherosclerosis. And we'll talk about that shortly. Some imbalances, homeostatic imbalances with blood vessels. You could have plaque buildup on the inner walls of arteries. That plaque can be made of fat, calcium, cholesterol, or even fibrin. So you can see here what that looks like, and it's going to narrow the blood vessel. So that would in turn increase your blood pressure because your heart has to pump to force blood through that more narrow opening in your blood vessels. Atherosclerosis is that narrowing as well as hardening of the arteries caused by that plaque formation. That can be caused by high LDL, low HDL, so high bad cholesterol, low good cholesterol, hypertension, cigarette smoking, and diabetes can all contribute to atherosclerosis. Arteriosclerosis is kind of like the end stage of atherosclerosis. So after you've had that for a long time, that is the hardening of the arteries. If you remember, your arteries, the walls are, they have smooth muscle in them. They're supposed to be kind of flexible and be able to expand and recoil to their shape that they need to be. But arteriosclerosis prevents that from happening. Thrombus and embolism, we've talked about them with blood already, but we'll just review that now again. A thrombus, because they do deal with blood vessels. So a thrombus would be having a blood clot in, and it could be platelets, it could be fibrin that kind of collects there on the inner wall. But having that kind of clot there in an unbroken vessel would be what we refer to as a thrombus. When a piece of that breaks away, so right here you can see a piece of that thrombus broke away, that is an embolism. Okay, an embolism can also be caused by pieces of plaque breaking off, fat breaking off, or even air getting into the blood vessels. Another issue is something called an aneurysm. That is when there's swelling along the wall of a blood vessel where there's a weakness in the wall of that vessel. That can rupture, especially in the case of somebody having hypertension. And if that happens, that can cause immediate death. So you would see here kind of a swelling. Let's say this person has high blood pressure, untreated, that can rupture. And here you can see an actual aneurysm there. And then our final thing that we're going to talk about here is a stroke. A stroke is when usually there's a blood clot in a vessel to the brain, but really what it means is that blood flow to the brain has been cut off. There are symptoms of a stroke, which it's important to know symptoms of a stroke. It's important to know symptoms of heart attacks because those conditions can be, I don't want to say they can be, they can be prevented possibly, but what's the word I want? Their severity can be decreased, I guess is what I want to say. So knowing the symptoms of a stroke is really important because if you or someone that you're with is experiencing these symptoms, the quicker you can get them medical treatment, the more likely you are to help keep the stroke from becoming fatal or even having like more severe complications afterwards. So some symptoms of strokes include trouble understanding, like comprehending, or speaking. A person might have numbness in their arm, their face, or their leg. They could have blurred vision, even double vision, a really sudden severe headache, vomiting, dizziness. They might have difficulty or trouble walking. They might lose their balance or their coordination, have weakness of their face, their arms, or their legs, or kind of have a droopy face or an eyelid. They might also be confused or even pass out. Okay, so some of the things we see here, so 40 seconds, every 40 seconds somebody has a stroke. 1 out of 6 people will suffer a stroke in their lifetime. It's the #1 cause of disability in the United States, and it's the #5 cause of death in the United States. Okay, so they are fairly common, and again, knowing these signs and getting somebody medical help will help to keep those things from happening, help keep people from becoming disabled possibly, or from dying from the stroke. So we use an acronym called FAST to be able to spot a stroke. So if you are with someone who is having like drooping on one side of the face, like their muscles in their face are drooping and maybe like their eyelid is kind of hanging down a little bit, the corner of their mouth is hanging down, usually that's on one side of the face. Arm weakness, so if you see that and if somebody's like slurring their words, which is speech difficulty, arm weakness, you can have them try to hold their arms out at their sides. And if they can't do that, especially on one side, that would fall under arm weakness. Asking them to repeat sentences and them being unable to do that or slurring their words. If they are exhibiting those 3 things, it is time to call 911. So the F in FAST is for facial drooping. The A in FAST is for arm weakness. S is for speech difficulty, and T is that it's time to call 911. A treatment for a stroke is something called TPA, which stands for tissue plasminogen activator. That is what we call a clot busting medication that would break down the clot that is blocking blood flow to the brain. but it's only approved to be given within 3 hours of the onset of stroke symptoms. So that's why it's so important to get them medical attention as quickly as possible. We will be doing some more things with blood vessels and with blood pressure as we wrap up blood vessels before spring break.